Hello, everyone. Welcome to Cracking Addiction. My name is Dr. Fergal Armstrong, and once again, we have the good Dr. Laura Petracek. Laura, I thought we'd continue our discussion from last episode and have a chat about why some patients feel that they don't need to achieve abstinence and why they might feel they can control their substance use or their drinking. What do you think is going on there?
Well, I think there's a few psychological aspects going on there, Fergal. One is that some clients have a cognitive distortion or they're in denial that they can control their drinking or drug use. And
Yeah,
especially if they've had times where they could actually control their drinking and drug use, they'll
yeah,
grab on that information instead of the information that's to the contrary.
yeah,
Um,
yeah.
a lot of
So they're
times
relying on
patients.
past experience.
Yes, which is maybe 50-50. 50 they controlled it, 50 they didn't, or maybe 80-30, 80-20. Yes.
Yeah.
Um,
But the problem with substance use is that you lose control of your consumption, isn't it? That's one of the diagnostic criteria for substance use disorder. And the the longer that you swim in that sea, the more likely it is for it to suck you down, isn't it?
yes, the likelihood is more of sucking a patient down. However, going back to that cognitive distortion, a lot of times patients are in denial. They don't see it. You know, maybe their family does or their employer, but a lot of times they themselves don't see how they're going down the rabbit hole.
So we've agreed that there's a cognitive distortion going on, and we've agreed that part of the reason is that they're relying on past experience. But that's not surely the whole story. What other reasons are there that permit the existence of this cognitive distortion?
Well, put simply, people like to drink. People like the
Yeah.
effect. They don't want to give it up. That's
Mm.
probably the number one uh,
Yeah.
reason is, yeah,
And
people
then there's
like the effect.
denial, isn't there?
Yes,
What's the underlying root cause of denial, do you think?
they don't want to give up their drinking and they don't want to give up the good feeling that it gives them. Minus they don't think about the next day, the hangover, or all the negative consequences. They don't want to give up that quote unquote good feeling when they drink.
And or that kind of that positive rewarding effect is perhaps being used to treat an underlying negative emotion.
Yes, there's a lot of reasons why people drink. It could be underlying negative emotions. It could be a whole host of issues or situations or past experiences that they want to continue to drink and suppress those feelings or experiences.
So how do we approach treatment in someone who's in that phase where they're engaged but they're not acknowledging the need for abstinence? How do you actually approach that kind of patient?
Well, I think one of the first courses of action is using harm reduction report, a harm reduction approach or motivational interviewing, so
Hmm.
taking a step back from the complete abstinence track and
Yeah.
meeting the client where they are. Like, it's interesting. I just had a client before our podcast who said, Dr. P, I looked at your book and, I got to tell you, I just don't see me as being completely abstinent. So are you going to still be able to work with me? Or should I find
Hmm.
another therapist? Because she goes, the more I read about the 12 steps, the more I kind of had a recoil reaction. And so I said, yes, we don't have to do total abstinence. So I do think
Hmm.
it's important to start where the patient is. And if
Yeah.
they're ambivalent and don't think they're alcoholic, then we need to start there.
Because it's very frightening, isn't it, for someone who's relying on alcohol for whatever reason to suddenly contemplate life without it. It's like jumping into a cold bath, isn't it? That's just awful.
Yeah. I mean,
Yeah.
it's like you said, jumping in a cold bath, jumping into a cliff. I mean, one of my clients once said, I know alcohol is killing me, Dr. P, but I know it. This is a known factor. I don't know if I stop what that world's going to look like, and it scares the shit out of me. And so I'd rather go down this
Yeah,
destructive path. And that to me was illuminating, but
yeah.
also sad.
So when I meet patients who say to me that they want to achieve controlled drinking, which is when I hear controlled drinking, I actually hear I don't actually or I cannot contemplate abstinence. I sometimes feel that really it is a cognitive distortion, and really I have to join them where they are, as you say, and I'm looking for that opportunity to then have the conversation with them about, well, you tried controlled drinking, where did it get you? What's the alternative option? Do you ever come across that kind of patient?
Yes, as I stated earlier, I'm working with one right now. So my
Yeah,
approach right now with where she's at is to have her keep a journal, an alcohol journal of what was going on before she picked up that drink, how much she drank, what did she drink, and how did she feel afterwards. And so part of
yeah,
it is a lot of times patients have no idea how much they really consume. There's even
yeah,
denial. There's a lot of denial right there. But it's them,
yeah,
so it's using their own information they gave me to then say, okay, well, you wanted to have 4 drinks a week, and last week you had 10. So what do you make of that? How is this working for you? Or do you
yeah,
think it's working for you? So it's helpful. It's more helpful if they come to the conclusion of, wow, this isn't working for me. It helps break
yeah,
that denial.
yeah. The other thing I often think about when I consider the goal of abstinence, it's a negative goal for some people, isn't it? Because people will say, my goal will be to not drink.
Mhm.
When really we know that negatively framed goals are not as good as positively framed goals. And so, I think moving that shifting from I don't want to drink to I want to be sober, I want to achieve abstinence, I think is an important part of the journey. Um, and I also think that it's a journey that is so frightening. And I think there's two things that I think about when I approach this. Is first of all, I've got to understand what the driver is for the alcohol, and then the second step is to actually start breaking down the very next step. Because if you start thinking of the mountain that you've got to climb, you lose sight of the step in front of you and you stumble. So
Yes.
really my focus in helping these patients is understanding why, what utility does the substance give them, and what is the next step, then the next step, then the next step. Now, the utility for people, we've already agreed that, negative emotions, trauma, but we have to acknowledge the impact of trauma in people's lives, and also potentially other perhaps impulse control disorders that are going on. How would you deal with trauma in this context?
Well, before I answer that question, I have a question to your commentary now. Um, so you're saying, Fergal, that to work with the client, to take the first step. What would what would be your first step with that client?
Okay, that's a very good question. So, in my practice, what I would do is basically I say to people, I'm not asking you to quit drinking right now, right? All I'm asking you is to commit to seeing me repeatedly. Engagement. So that's got to be the first step. And
Oh,
if people want to fade, I'm happy for them to fade. And I'm happy to walk with them as they fade. So basically, I will suggest that they actually cut down by one drink a day, or if they want to just cut down by one drink a week, but keep an accurate diary. And I know that it's the key thing is honesty. So if I build a space within which people are actually able to discuss openly their failures as well as their successes, then we will actually get an honest picture of what's going on. And so there has to be that time when You create an honest, safe space to discuss progress. And if patients can actually start managing their progress, and if reductions are possible, that's great. That's great. But then at some point, if progress is not being made, then I have to ask the question, well, actually, do you need an alcohol detox? Do you have such severe dependency that you just cannot actually get over this without becoming sick? And then that's when I can arrange an alcohol detox. The trick about an alcohol detox, however, is to actually maintain abstinence after it. But it is literally one day at a time, one step at a time, and engagement not just with me, their doctor, but engagement with AOD counseling, with psychological counseling to deal with all of the other background underlying drivers of substance use, plus the trauma, as I've mentioned, and also peer support networks. Because there's one thing that I do know is, you can't raise it takes a village to raise a child. It takes a village to achieve sobriety, I think.
Yeah, that makes a lot of sense to me, to have them not necessarily commit to abstinence, but commit to seeing you each week. I like that, because then that's more likely they're going to come back,
Yeah.
and work with you. Yeah. So, in my professional experience, a lot of times, if I kind of go head on into working with the client, into their trauma, I've seen a lot more relapse happen. So now I'm usually waiting, so they could get the skills and concepts together and get some kind of baseline of sobriety before tackling that trauma. So, for
Hmm.
example, I had a patient who, on her own, read the book Basil Welk. Yeah. Okay. So she decided basically she was, on her own doing this trauma work, and she had only shared about reading this book at the very end, and then surprise, surprise, or not a surprise, the next week she told me she relapsed. So I think two things: working with a patient that has trauma, we've also have to stay very close, in terms of our support, or getting a support system for them. But ultimately, I find it's better. And this client had almost 2 years of recovery. But I would have told her, had I known she was reading the book, it's too soon. It's just too soon. I would be afraid of relapse, and unfortunately, that's what happened.
There are those that would say that you need to acknowledge, at the very least, and accept the fact that there is trauma in people's lives. You can't ignore it during a recovery process.
Oh, I'm not necessarily saying ignore it. I'm more saying, yes, acknowledge it, like you were stating, but not going head on into it, until there's some stability.
Well, I think for me, for really all substance addictions, it's important to understand the drivers, and I think trauma is a huge driver for substance use. It's not the only driver, but it is an important driver, and I don't shy away from asking questions about what does the substance do for you, and why is it so good for you. And I don't shy away from asking questions that allow the patient to express the fact that they feel that they've been traumatized. And I suppose when I'm chatting about it, I don't, I'm not a trauma therapist, so I'm not trying to help them directly with their trauma, which is why I go back to the fact that it takes a village. So they need to see someone who's a specialist in trauma therapy. But I use some basic principles around it. I don't, I have to show the patient that they're in a safe place. I have to be aware of their tender points. I have to give the patient a sense of control, and I have to celebrate their strengths within the fact that they have suffered. Because my patients, by definition, anyone who sees me after having been traumatized is a survivor, is a success, has got strength. If you manage to get to see someone you need to be congratulated for having the strength to get through that front door.
Hmm.
So those are my approaches, but I don't try and well, minimize it, cover it up. I perhaps this is one of the very few points where I might disagree with you in terms of actually helping people through recovery. But I don't do the trauma therapy myself.
Okay. So you would refer them out?
It's an interesting point.
Yeah.
Yeah, I'm not. I'm a doctor. I a specialist in addiction medicine. I'm not a trauma
Okay.
therapist.
So would the treatment be concurrent with yours? Like here's trauma therapy.
I believe so.
Oh, okay, okay.
Yeah,
I,
yeah. But do you treat people with trauma?
yes, I do treat people with trauma without necessarily having an alcohol or substance use problem. But this is interesting. What I'm hearing is, like, so one therapist, one clinician as yourself dealing with the alcohol use problem, another therapist dealing with the trauma. I think that might be a better route to have two separate therapists for two separate issues. Clinically, I think that's a sound idea.
I suppose it speaks to the idea of dual diagnosis, and really one of the key treatment principles for dual diagnosis is that you try and integrate treatment as much as possible, and you try and treat the whole person. So one of the issues that I've come across is that if you is you know we're all worried about relapse, but what I'm worried about is a lack of progress and or relapse, because if you don't treat both problems, or if you don't treat all problems, if you don't address all problems, then eventually relapse happens much more. Well, I believe it happens much more quickly. I feel that that it's important to give a wraparound service as much as possible. And I'm just
Mm.
thinking, I mean, if someone had an alcohol problem and needed a detox, and they were using alcohol to help them cope with a significant amount of trauma, I would still offer them an alcohol detox. They'd be going to counseling before they came into hospital, and they'd be going to counseling afterwards.
Mhm.
And I wouldn't say deal with your trauma before you can deal with the alcohol.
Right, right. Yeah, that makes sense.
If we go back to the overarching theme of our conversation today, which is basically, this idea that people can live in a phase of denial, and that denial can allow people to achieve controlled drinking. There are, however, some people that can actually achieve controlled drinking. They're rare in my experience, but people can achieve controlled drinking. What's your experience of that?
Well, I agree with you. There are people that do. Um, I remember early on in my recovery, and one of my uh, friends in recovery decided, AA wasn't for her and that she wasn't an alcoholic, and decided to not go, quote, back out there, but to live her life and drink uh, responsibly, as she put it.
Hmm.
And then I ran into her like 3 or 4 years later, and her life was okay. She wasn't like you know in jail or falling down or And then most recently, it came up with another friend of well, actually, two people I've known in my circle after 10 years of recovery have gone back out or had decided on controlled drinking. And for one woman, it's been almost 10 years. And, from all the markers, it seems like she's doing okay. And this other woman, it's been about a year and a half. And she finally said, Laura, I have to tell you, I'm not sober. And I feel like I'm lying to you because when you come visit me, you'll go to a meeting, and this is why I'm not going with you. So I appreciate her honesty. And, she seems like she's doing okay too. So I don't think I do believe some people can control their drinking. I don't think it's a big
Hmm.
percentage. I myself would not risk it. I would, I'd
Yeah.
have too much to lose, but I do believe some people can.
So, is there any way of predicting which kind of individual will
Uh,
manage to achieve it and which won't?
that is the $100 question.
Yeah.
$1 million person. Yeah. I mean, who knows? I mean, I'd say for, these three that I know that went out and did okay, I could probably name 300 who went out and did not do okay.
Yeah.
I think it's a very
Yeah.
small percentage.
It's
And
it's a gamble, isn't it? If we're talking
it
about
is.
addictions, it is a gamble because I don't believe that I can predict the person who will manage to do it. But
Yeah.
I'm of the opinion that the majority of people will not be able to do it. So it's sometimes it's a difficult conversation to have. And really, I suppose the only way to manage that is just to walk with the individual. And as you say at the very beginning, meet them where they are
Right.
and
And also
engagement.
go over oh, excuse me. Yes, and go over some of the, potential consequences. So let's say
Yeah.
you pick up that drink. Okay. Since you've gotten sober, you're married now, or your marriage is stable. You've, you know, re-engaged with your kids, or there's less estrangement there. You're working things out. You got a new job. Your health is better. You're not, your kidneys aren't in danger anymore. Now, are you willing
Mm.
to risk all of those successes? And kind of have them work that out. And for myself, I kind of have this, I don't know what you call it, kind of game, so to speak. Like, if I think about it, one of the things I ask myself, what's something I haven't done in recovery? What's a challenge, a positive, not a harmful challenge, that I haven't tried yet? So let's try that before picking up a drink or a drug. And
Mm.
so it's skydiving or what? No, it wouldn't be sky. I wouldn't do that anyway. But what's another quote unquote experience or thrill or something? Because, like, initially for me, it wasn't even my own history that convinced me about not picking up a drink or a drug, but I saw my family, how their drinking, they deteriorated through the years. So that was
Mm.
enough of an experience, or enough of a research for me,
Yeah.
that, wow, okay, I didn't really see it then, but now I see it, and it's not worth it to me.
Perspective, that's what you've got, isn't it?
Yes, yeah.
And if only we could give other people, our clients, perspective.
And I think this is where bringing in the family is helpful, you know, um, because it's hard for our one client to break that denial on their own. And that's why I like to do, if possible, an intervention with the family members or their family of choice, to help them see how drinking and or drugs has affected them.
Well, look, Laura, on that sweet note, I think we're going to have to end it because we've run out of time. But I really hope that we can chat again very soon and continue our discussion. Thank you.
Thank you, Fergal. And for all the listeners out there, um, please don't forget to look for my book, DBT Workbook for Alcohol and Drug Addiction, on sale at Amazon. Thank you.
That's all for today, folks. My name is Dr. Fergal Armstrong, and this has been Cracking Addiction.